Hi, everyone. Thanks so much for joining me. I'm so excited and really grateful to be here to get to present on another important topic in our series on our metabolism and how to use our fat stores as energy versus storing fat. And today I want to talk about intermittent fasting and heart health in this edition of building on the series we've started together. Remember, I am basing this information from the Complete Guide to Intermittent Fasting book by Dr. Jason Fung, which I will share at the end of this presentation. My name is Linnea Baker, and I am a board-certified family nurse practitioner. So thanks again for joining me. So first, we want to talk about what is cholesterol. There's so much information about cholesterol out there. This is something I've dealt with in my the majority, actually all of my healthcare career, and I've been in medicine for over 25 years. I did have a majority of my background spent with cardiology, cardiometabolic disease, and electrophysiology. So cholesterol was a huge part of what I worked on with patients. So when we talk about cholesterol, what cholesterol does is it repairs cell walls and it also makes certain hormones. And it's so vital for human health that virtually every cell in the human body has the ability to manufacture cholesterol if needed. Sorry. And that's by Dr. Jason Fung. It's on in one of the on page 157 in the book, The Complete Guide to Intermittent Fasting. This is so powerful. And I really wanted to start with this quote, because we are taught that cholesterol is bad for us, and we actually need cholesterol. It's absolutely vital to our survival. So we need to break this down a little bit, and this is one part of what we're going to be talking about. The next series that I'm going to do is actually going to really take a deeper dive into our heart and brain health and talk more about cholesterol and other risk factors for heart disease and stroke. But for today's topic, I'm just going to introduce this on the scale of how it relates to intermittent fasting. So cholesterol and LDL, you may have gone to your provider and they checked your total cholesterol and your LDL. And the way I like to tell my patients and educate people on the LDL and the HDL, when you get your total cholesterol, you will have a number under that. That's the LDL, and you will also have a number for the HDL. LDL, we always consider the quote unquote bad cholesterol. HDL is the quote unquote good cholesterol. I always thought of H as helper. So HDL is the helper cholesterol, the good cholesterol. Okay, so when patients or clients or people who want to do a health consult with me are talking about their cholesterol, when they give me a total number, I always want to know what the breakdown is. I don't go by the total cholesterol. I need to know what the breakdown of the cholesterol is. Okay, and then separate from that, we'll talk about triglycerides. So lipoproteins are the parts of the cholesterol, or actually the cholesterol that travels in the bloodstream, and they actually bind to proteins. Okay, and when they're bound to the protein, the lipoprotein, depending on which one they're associated or bound to, that tells us if it's an HDL or an LDL. It all depends on which lipoprotein it's associated with or bound to, okay? And there have been several large studies that have associated an elevated or high LDL cholesterol level with an increase for cardiovascular disease or a risk factor for having heart disease, okay? And a lot of times you will be prescribed a statin drug such as simvastatin, atorvastatin. Those are also called Zocor and Lipitor, but there's several drugs out there that are statin drugs. They've been out a long time, and those are the drugs of choice when we have an elevated LDL, okay? Now, initially it was thought that the elevated cholesterol, it was directly related to eating too much cholesterol in those higher fat foods. And this is where it gets interesting, guys. Triglycerides. Okay, this is another part. When you get your total cholesterol, they'll break down your LDL, your HDL, and then there's a triglyceride number. And I also need to know what the triglyceride number is, because triglycerides are actually directly related to your blood sugar. Okay, and I'm going to show you how that works here. It's so interesting that you guys are going to know the why behind how my brain works. So hopefully this brings you value. Triglycerides are another type of fat. Plus, they have their own risk factor for heart disease separate from LDLs when they're elevated. So we talked in the prior presentations about the glycogen stores storing the glucose, which is our blood sugar, in the liver. as glycogen for intermediate energy. So anything we eat that we need is immediate energy. We take that glucose and burn it right away. When we have anything left over from the carbohydrates, that's the glucose, which is our excess sugar and carbs. We store it as glycogen in the liver as intermediate energy, or to be used at a later time. And it's easy to access, like accessing the refrigerator. We talked about that. And we said there's a max capacity that the liver can hold glycogen. So once those glycogen stores are full, any excess sugar or glucose gets put in fat cells for storage. And we called that the freezer. And we said that's an unlimited storage space. Okay, so this ties back to what we've been talking about. Well, this is where it's important, because when the glycogen stores in the liver are full, okay, they start converting the carbohydrates to triglycerides. Okay, and we also talked about how carbohydrates and proteins are converted to glucose, which is sugar. Okay, and the only thing that's not converted into glucose is healthy fats. We talked about that in one of our earlier presentations. So we have glycogen stores in the liver for the glucose, and when the liver is full in those glycogen stores for energy, we start converting the carbohydrates into triglycerides. And we transport these triglycerides out of the liver in what's called very low density lipoprotein, or VLDL. And it is the VLDL that is used to form the LDL. And we said LDL is the bad cholesterol. We need to realize that an abnormally high or elevated triglyceride level actually is a separate independent risk factor for heart disease, okay? If you have high triglyceride levels and the cutoff is 150, your risk of heart disease increases by 61%. That's separate from if you have an increased LDL, the quote unquote bad cholesterol, that's its own separate risk factor for heart disease. We know, and when we look at research and we study the population in the United States, that triglyceride levels have increased. I'm sorry, I'm having trouble speaking. This happens sometimes. I get so excited. My brain is going faster than my mouth can keep up. Triglyceride levels have increased since 1976, along with type 2 diabetes and insulin resistance. Well, that makes sense, guys, because I can tell you diabetics who are not controlled have elevated triglyceride levels. Triglyceride levels go up when your sugar is not controlled, which means your fasting blood glucose is high, or maybe your A1C is high. You're going to see high triglycerides. These are risk factors for heart disease, okay? And we know that triglycerides will respond to diet changes because they're direct relation to the intake of sugars and carbs. But because of what we've done in the United States with eating a carb-heavy nutrition, and that's our Western American diet and culture, by increasing our carb intake, not only have we increased obesity and type 2 diabetes and other chronic diseases, but our triglyceride levels have significantly risen as well. So when we talk about high cholesterol not being a dietary problem, what do I mean? Well, the USDA's American Dietary Guidelines, and this is a quote, they wrote, avoid too much fat, saturated fat, and cholesterol. And they were talking about things like egg yolks and red meat. And a lot of you know, like, we're supposed to avoid red meat. We're not supposed to eat a lot of eggs. Well, actually, this is wrong. And research in the scientific community have long been aware that eating less cholesterol does not lower cholesterol, right? 80% of cholesterol is actually created and made in the liver and found in the blood. So eating less cholesterol makes no difference because it's our liver that's creating it. So the National Dietary Guidelines published in the United States and the UK in 1977 and 1983 recommended that we have a low-fat diet to reduce the risk of heart disease, okay? And when you look at all the meta-analysis and reviews after all these studies have been done, so when you take all that data and you go back and you look at it, this confirms that there is no evidence to support these recommendations. And there was no evidence at the time that these guidelines were published. And still today, there is no evidence to support that eating a low-fat diet reduces the risk of heart disease, okay? So we do want to avoid trans fats, and there are things we want to do to help lower our risk of heart disease. And we're really going to delve into this with this really great book on heart and brain health that is going to be our next topic. But for now, just know that there's no data supporting this, okay? That does not mean I'm telling you to run out and eat fast food, because we definitely want to avoid the fried foods and the trans fats in that. And but just choosing healthy foods, and we do not need to fixate on a low-fat diet, okay? And eating more carbs, especially the simple carbs, is not good for our bodies. So the Harvard School of Public Health, and this is a quote from Dr. Frank Hu and Walter Willett, it is now increasingly recognized that the low-fat campaign has been based on little scientific evidence and may have created unintended health consequences. So these guidelines that were put out in the late 70s and early 80s, which is the era that I was a child, okay, actually said, the Harvard School of Public Health is saying, hey, we agree. There's no evidence to support this. And actually telling people to eat low fat meant they ate more carbohydrates. We increased obesity. We have higher rates of childhood obesity and diabetes and cholesterol issues. We have higher rates. Over half the adult population in the United States is pre-diabetic or type 2 diabetic because of the increased carbohydrate intake with this quote unquote low fat diet. Heart disease is the #1 killer in the United States. We have more obesity. We have more chronic illness in the United States. So by following these guidelines, we actually created more harm than good. So why does fasting lower cholesterol? Well, we know the liver produces the majority of cholesterol in the blood. And as the liver senses that there's less cholesterol coming in from food sources, it can simply increase its own production, okay? So with fasting, as we decrease carbohydrates, the liver decreases the synthesis of triglycerides. Remember, when we're eating carbohydrates and we take in any kind of carbohydrates, the liver takes whatever's left over, any excess, and converts it to triglycerides. So when we fast, we're not taking anything in, which means we're not going to make triglycerides. And since there's no excess carbohydrates to make triglycerides, with no carbohydrates, we can't make triglycerides, right? So we know that the triglycerides are released from the liver as the VLDL, which is what forms the LDL. So if we lower the VLDL, we lower the LDL. So when we fast, nothing's coming in to overflow the liver to be turned into triglycerides. We need triglycerides to make the LDL from the VLDL that the liver releases. So hopefully that makes some sense for you guys, okay? Now, fasting and cholesterol. The only way to reduce LDL is to reduce the liver's production of it. And research has shown that 70 days of alternate day fasting could reduce the LDL, quote unquote, bad cholesterol, by 25%. And this is significantly more than what we see in any other diet and what it's capable of achieving. And it's about half the effect of a statin medication. Now, I don't want you to look at medication as bad. Statin medications are powerful, and they're actually very effective and very necessary. And there's a lot of information about anti-inflammatory benefits of statin medication and how they can benefit the arterial disease. So any kind of heart disease, strokes, the blood vessel lining, your arteries are where plaque forms. Okay. So like the arteries of the heart is when you have coronary artery disease. That's one area, but any artery lining, and that's where the oxygenated blood flows out through your body, can get plaque buildup. Okay. And even if we have normal cholesterol levels, there's still situations that statins can really help improve arterial health, which means we'll have less likely plaque buildup that can create plaque ruptures and can block off arteries. And that's when you have heart attacks and strokes and peripheral arterial disease and things like that. So we want a healthy lining. The inside lining of the arterial blood vessels, they're all made up of the same thing. We want them to be very healthy, and statins can be a very effective way to help that in many cases, aside from just lowering cholesterol. So I do not want you guys, with all my background in cardiac and how long I've been in healthcare and what I've seen with statins and also what's in the research, I'm not telling you to stop your medication ever. This is something that you discuss with the provider that's managing your cholesterol, whether it's your PCM or cardiology or whoever's doing that for you, because these medications are powerful and can really help. And you can do significantly more harm than good if you suddenly stop any medication. But this would be one of the most important ones that you don't want to just stop. So what I am telling you, though, that a lifestyle approach can help achieve quality of life and improve your health span, and also work synergistically with any other treatment you're using, okay? And if your goal is to get off of medication, well, depending on your situation and what your numbers look like and what else is going on, that's a conversation for you and your provider. And this may be one way to help to get your numbers where you could show them you might be able to come off medication. But that is a discussion between you and your personal healthcare provider who knows you best, because this is never a one size fits all, guys. And remember, I always say we don't want to do any harm. So you always work with your personal healthcare provider. And this is just education to empower you to have those discussions and give you the verbiage to have those discussions with your healthcare provider. Also, with fasting, triglyceride levels drop by 30%. So that's similar to what you could achieve with a very low carb diet, which would be less than 3% carbohydrate intake or medication. So another great result. And we said triglycerides, again, had a separate risk factor for increased risk of heart disease, separate from LDL being elevated. So fasting and cardiovascular benefit, fasting improves multiple cardiovascular risk factors. We can reduce body weight, we can preserve lean muscle mass, we can decrease our waist circumference. That's a big one for cardiometabolic disease and risk factors for heart disease. And it also preserves the HDL. And we said HDL is the good cholesterol, the helper cholesterol, and we don't want to lower that. And a lot of times when we go on these low-fat diets, we can actually lower the HDL, and we don't want to lower the HDL. We like the HDL to be higher to a point. So this can help preserve that number. And so in summary, there's no scientific evidence to support that a low-fat diet reduces your LDL. The liver produces the majority of cholesterol. We said 80%. When we have excess carbohydrates, those are converted to triglycerides in the liver, and that's used to used to form the LDL bad cholesterol. And fasting is shown to lower the LDL as well as several other cardiovascular risk factors. We said that if you want to go on a lifestyle change, whether it's changing your nutrition or adding in intermittent fasting, that if you have any chronic medical conditions or taking any kind of medications, that you are to discuss this with your personal healthcare provider so that we do no harm. And also discuss it with the specialist managing whatever that chronic disease and medications are. If you have diabetes, absolutely, you need to have that discussion and be cautious with fasting, because we don't want to do any harm, and you could end up hurting yourself more than helping yourself. But that's the case with a lot of different medications and diseases. So just having that discussion will prevent any bad outcomes and help support good outcomes, okay? And we said if you're breastfeeding or pregnant, this is not for you. No fasting for anyone who's breastfeeding or pregnant. You have different nutritional demands. This is not for children under 18 years of age. They have different nutritional demands. This is also not for anyone who has any kind of malnutrition. We don't want to be doing intermittent fasting if you are lacking in nutrition or have malnutrition or are malnourished, okay? So what's next? We're going to talk about fasting and anti-aging, and this just totally lights me up. The information I have found out there is incredible. I personally feel like I'm reverse aging at the age of 48 years old compared to looking at pictures 5, 6 years, 7 years ago. I feel like I look younger and healthier. So this is exciting. If you haven't watched the videos in this series from the beginning, we do build on each one. I try to highlight and bring up a little bit of information to catch you up, but it is helpful to go back to the first video, which is debunking calories in, calories out, and then the videos follow. Those are pinned to the featured section of my health and wellness Facebook group. And you can also find me on YouTube. The videos will be pinned there once they're aired on the Facebook page, okay? I am on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan, guys. I am truly passionate, if you can't tell, about education and health and wellness and serving others and taking care of people and creating health for families. This totally lights me up. So if you are frustrated, not sure where to begin, need some help, need some verbiage or guidance so that you can have these discussions with your personal healthcare provider, please private message me or comment below to schedule a free health consult with me. This is my heart and my passion. I would like nothing more than to get to have a conversation with you and see what things we might be able to do to help you get started on a holistic and sustainable healthy lifestyle. And in closing, I just want to let you guys know The Complete Guide to Fasting by Dr. Jason Fung with Jimmy Moore is absolutely the book I've been basing this series off of. Lots of great information in here. I am just taking snippets out of it, but he is powerful in how he presents this. And this is written for lay people. That means you do not need to have a medical background to read this book. I ordered mine on Amazon. It's worth the read. It gives great information. You could take this book into your healthcare provider and have a conversation. There's so much more information in this book than what I'm covering. I'm just hitting a few little highlights to bring some education to you. Okay, so please, if you're interested in more information on that, go ahead and order that book. And like I said, I got mine on Amazon. Guys, I can't wait to give you the next presentation on anti-aging and intermittent fasting. Until then, thank you for your time. Thank you for listening, and please be safe.